Hello, my guest today is a physio-occupational therapist and specialist in sports medicine and clinical weight loss management. Currently medical director of Physioslim as well as head of physiotherapy at the Sujay hospital. Please welcome Dr. Sameera Desai Gupta. Hi Sameera, how are you?
How are you?
Welcome to the show.
Thank you.
Tell me a little about yourself and all the work that you do.
Well, I'm a physio-occupational therapist specializing in sports medicine.
Yes.
And I look at patients from all walks of life. I firmly believe that nothing can stop you from growing young, and the body is the best weapon against all odds. So keeping that in mind, when you want to have a fit body, you have to have a fit mind,
Right.
and vice versa.
Right.
So here at Physioslim at Sujay Hospital, we are very much catering to patients who are dealing with pain, pressure, swelling, ailments, aches and pains. And of course, these are very common in all different age groups.
Right.
My main target is to relieve them from their pain and also to get them fit and back to life.
Great.
So age is just a number.
Of course, I agree with that. More about that, hold that thought. First of all, let me congratulate you,
Thank you
on
so
this
much.
lovely trophy on your
Absolutely.
mantelpiece.
Oh, I think this is such an amazing thing that you have done, and I'm so happy that it's there. It's made me very, very
Is there
proud.
someone you would like to thank, someone who is from your family, who has been your backbone to where you are heading this place?
Yes, of course. Today I would definitely love to thank my two best friends, my parents, both of them, and especially my mom. She has been the mentor, she has been the director, and she has been the backbone. It was her sheer dedication, her vision to see me successful, to continue the family tradition of being a doctor in every generation that we are.
Is she also a doctor? Is there a history of doctors in your
Well,
family?
she isn't a doctor, but we have a history of generations of doctors.
Wow.
And high achievers, lifetime achievement award winners.
Wow.
Where we are looking at gynecologist, world president gynecologist, who's my aunt. My uncle, who's a lifetime achiever for ENT surgery, microsurgery of the year. So we were just looking at one more to add to the generation of doctors.
Superb. And in your siblings, I know you have two sisters.
Yes.
You're
and
the
one
only
brother.
one, and one brother. So you're the only one who got into the medical field?
Yes, we did. I was the only one. I'm the youngest out of all four of us.
Yeah.
And that is all the more reason why my brother and my mom felt that in spite of everything, my focus was there, and they just wanted me to do what they felt.
And you're
was
also the pampered one. I can see that.
Absolutely, being the youngest.
Always happens. So coming back to your work, tell me a little bit more about what is it that you specialize in. When you say sports medicine and fitness, tell our viewers a little about your work.
Okay, now the point is that here we are looking at
There's
patients.
nice coffee there.
Yes, thank you. And we are basically looking at patients from all age groups. We have kids from say 2-year-olds to males who are females.
2 years old?
2-year-olds to 95-year-olds. Whoever can walk into my cabin, and in case if they cannot.
Goodness me, I would not have thought of a toddler being a patient here.
Of course, we are into physiotherapy and occupational therapy here, where we are helping patients get mobile, get fit. So fitness is, as I told you,
age group.
It's any age group. The patient who can walk, at 2 you can walk. So yes, you're going to walk, you're going to come here with your whoever.
Yeah.
Patients who have diabetes, blood pressure, thyroid, and suffering from any of the orthopedic conditions and neurological conditions, where there's a nerve compression, from facial palsy to lower back pain to knee replacements to knee rehab to shoulder rehab. We're looking at patients with life.
That's a lovely thing that you're doing out there. So how do you reach your diagnosis for a particular case?
Okay, now the thing is that here we have a very holistic system approach, and that is the USP, where we are looking at patients who have actually come at a one-stop shop. The hospital is such that we have all the high-end doctors which are under one roof.
Super.
And there we kind of, in case if I feel that there is any cross checkup needs to be done, or any reconfirmation from any other.
So you have an in-house.
We have a teamwork.
Very nice.
And here I'm also specializing in the most advanced technology for patients with all age groups again with patients suffering from PCOD, that is polycystic ovarian diseases, or cancer, or diabetes, where we're looking at the advanced technology, which is right here. The fastest and the slimmest method in treating our patients is the ulipolysis, where the machine is the first of its kind in a hospital setup all across India.
Lovely. Can our camera take that? Are we
Yes.
getting it? Great.
And there we are looking at the machine right here, which I can just show you.
Yeah.
Where we have the machine where we are treating our patients fastest, slimmest method with non-ablative radio frequency. The ulipolysis with the nerve.
Oh,
The
lovely.
ulipolysis with the nerve, that is a non-ablative radio frequency, helps our patients, where we are looking at an age bracket from 14 to 65, lose weight and get fitter in spite of their ailments. So one side we have a rehabilitation for medical fitness along with weight reduction. So we understand that obesity in itself causes a lot of issues.
Right.
So we can amalgamate the two
So you
and
club
bring
it.
it down.
Yeah.
Yes.
Yeah.
Yes, absolutely.
Superb. Is there any one case that you would like to pinpoint to our viewers
Yes.
that was very difficult or not so doable, which you enjoyed as a challenge?
Yes, of course. I had a patient who was working in a call center, and she was admitted here for her ovarian cancer, for which she had to undergo hysterectomy. We dealt with her severe back pain issues which she had, along with radiculopathy, where because of which she could not sit too long, could not stand for long. We helped her with physiotherapy. Along with that, we made her lose 14 kilos.
Oh.
So that brought her life back so beautifully back to normal, that she could sit for long hours, she's fitter, she's better, and doing odd jobs at odd timings takes a different toll on your health. And at the age of 35 plus, when you're looking at something like that, it's difficult. But with the weight loss, she was doing very, very well, and the rehabilitation got her back to life completely.
What's the job satisfaction that you feel when you come across results like this?
Well, I think touching a humankind and touching someone whose life is already under turmoil, physically especially, and you know that the patient needs a hand, and when you help that patient come back, and the gratitude with which they help, they look upon you and they give you
You're
the
like
blessings.
gods.
Yes.
Doctors are,
So I have
physical
patients
forms of
who are
God.
90, who are 70, who are 50, who are odd, and they come and tell me, Doc, I could not imagine doing this.
Oh, nice. How nice.
And then we had a patient who flew down from Muscat recently. He was here for a spine surgery, where we had a complete turnaround, where we started a physiotherapy in indoor, means when he was admitted. Because of his diabetes, the surgery was postponed, and we did physiotherapy. In 3 days, he had 20% recovery. He cancelled his physiotherapy. He cancelled his spine surgery. He continued physiotherapy at home, and then he flew back. And he's fit and going back to his bank work without the spine surgery.
So do you go for home visits as well?
Well, we have a teamwork. I do have my senior therapist, and I have junior therapists also. Depending on the case to case, we do help our patients. Yes, definitely. Home care is a very integral part of any physiotherapy.
Any of physiotherapists, I'm sure. Tell me, what are the side effects of all this stress and pressure onto the doctor herself? Do you carry anything back home? If there is any up and down or any of the emotional...
Well, initially, yes. When I was interning at Kehna hospital, I was very disturbed initially to see these kind of patients, because they go through a lot of psychological issues themselves. And when you're trying to help someone, you need to be sure about your status, mental and physical.
Mental health, absolutely.
Your mental and physical health versus to what he needs, and only then you can combat that problem.
100%.
So I would definitely say that yes, initially I was, but now I think I have bridged the gap between the patient and the doctor myself.
How lovely.
And I think I need to be here as a helper, as a survivor, and as a fighter.
Absolutely. And
So
for that you have to be
I have to
above.
instill the same instincts in my patient.
Absolutely.
So when my patient is sitting across the way you are, and they tell me, Doctor, just talking to you has relieved us
How
of our 50% of our.
That is the magic of the doctor,
Yes.
na? कि बातों में बात बन जाए.
Exactly. So we are 50% already better now.
Yes,
So we don't know what your
absolutely.
treatment is going to be like.
Absolutely.
I'm like, well, come aboard and come on the table. Let me,
Yeah,
start
examine you.
treating
Yeah,
you,
very good.
start treating you, and then we will kind of deal.
So how long have you been in this profession?
Well, I started my exact journey in 1998
Mhm.
versus to 2017. So it's been 20 long years.
Boy.
And I just had a beautiful, celebration of my 20 years along with the New Lipolysis launch, where I had supporting doctors and my patients working for me and supporting my cause of helping each and every person who's need not only to get fitter but have a better life, have a better quality of life.
Sure.
So that was very important because I believe that nothing can stop you from growing.
Absolutely. And did you always want to be a doctor? Right from day go?
Well, initially when I was young, I had this thing that urge of being a singer.
Hmm.
Yes.
That's something new. I didn't know this about you.
My love and passion for music has been always there as a kid. And in fact, I did take professional classes.
I need to hear you sing after the camera is off, and maybe one day when the camera is on.
Yes, for sure, because I'm an ardent singer. I love
Oh,
it.
you didn't say this to me earlier.
But you must have got it with my music. I kind of convey it because right now
Yeah,
my throat
yeah.
is a little
Yeah.
down. So
Yeah,
that's
spoken like a true singer.
Yeah.
You know.
So, but looking at my grades, family was very keen that I do it, and of course, looking at the vision which my mom had always had for me,
Right.
and I had put my life in my family's hands, saying that whatever you think would be right for me, I think I would
You
like
should
to
do
go
it.
with that.
Yeah.
Because
And this was the part.
and this was the
The
part.
destined journey.
Absolutely, and I think I couldn't thank them enough.
And my next question is alternative profession. I think you've already answered that. If not this, you would have been a singer.
Well, if I had the
Anybody else
chance
guess?
to pursue, definitely.
Que sera sera.
Could be.
Okay, coming back to Stri Astitwa, you have walked the ramp even before.
Yes.
And you did it again.
Yes.
So your experience is walking the ramp for your own brand, Physioslim, Dr.Sameera's Physioslim.
I felt this was an amazingly unique concept, most importantly, a very novel concept in itself, where you are wanting to walk your brand because you believe that what you're saying and what you're portraying is what you are.
Absolutely.
And I think that was an amazing thing. It was amazing. I walked in medical school, college school, fun, whatever,
Yeah,
but I
yeah.
think this was an amazing one.
Yeah.
And I Great, thank you so much.
The pleasure was all mine, and it is your moment of stardom. I can't take away from that. What are your extracurricular activities? You're here from what time to what time? Let's begin with your day first.
Well, we are here at the center is from 9 a.m. to 3 p.m.
Okay.
We have a busy schedule in the morning where we are looking at patients. Coming closer to the afternoon, we are looking into the admin part, and thereafter I go back home.
By what time approximately?
Approximately by 4 p.m. I'm home.
Okay.
Yes, and then I like to just, unwind a little bit. Thereafter, I try to spend some good quality time with my two kids.
Yeah. So you have a boy and a girl?
Yes, I have a daughter and a son, and I like to give them my time in terms of, helping them with their studies, talking to them, spending time with them, listening to them.
Are they also following Mama's path into the medical profession?
Well, I think as of now they are quite inspired by me, but whatever will be, will be.
Of course.
There is no pressure. There is nothing. Of course, we are kind of giving them a good direction.
Yeah.
Let's see.
Yeah. Tell me about your extracurricular activities and your me time.
Okay, for as far as my me time is concerned, it's very, very important to me. I'm in fact invited many times for the lecture on me time because I personally believe that me time is very important.
Yes.
So, I personally like to do that every single day of my life.
Yeah.
At least 5 to 7 times a week, definitely.
Before or after?
Well, it just depends on whatever time I can manage, because certain times we do try to strategize, we do try to analyze that this is a good time, but sometimes it doesn't work out. But it could be any time of the day, preferably morning, yes. If not morning, then definitely evening. It could be a 45 minutes walk, it could be a 45-minute jog, it could be cycling. I love biking.
Yeah.
So that's what I do.
Mumbai roads, you go biking?
Yes, I do. You would see me around. If you
Yeah.
really notice me on the bike, you
Yeah.
would. You
Yeah.
would. I like my time there.
Okay, that's lovely.
Gives me time to think.
Any
gives me
other
time-
hobbies that you pursue
Yes,
apart from something that is physical exercise?
Yes,
Okay.
I love music.
Yeah.
It could be from Hindi, English,
Listening and singing.
rock. Right now, it's more listening.
Okay. Okay.
More like English, Hindi, rock, pop, retro, 80s. Could be
So you
anything.
name it.
Anything.
So why are you not training under an ustad?
Right now, my priority
Mm,
are my kids,
I'm sure.
along with my work.
Yeah.
I think this is the baby,
Yeah.
which is 20 years old, is the oldest one,
Yeah.
because I'm 20 years old
Yeah.
in the line. But I think right now my kids need my focus.
Oh, sweet.
And
All
I
mothers
think-
are so sacrificing in
Yeah.
nature. Any message you would like to give our viewers before we say thank you to you?
Well, I would just like to say one thing, that you must try and try to succeed,
Of course,
and nothing substitutes
for hard work.
hard work.
So true. Thank you so much for this lovely, lovely tete-a-tete.
Thank you
Until
so
next
much.
time, bye-bye.
Thank you.